This video will cover information about lead toxicosis in cats. Lead toxicosis in cats is much less common now than it was back then when lead was used in a larger variety of products that were contained in the house. Nowadays, lead toxicosis is considered a rare health condition in cats. This video will go on to discuss sources of lead, how lead can contaminate water and soil, the increased risks that cats have with lead poisoning, as well as the signs and symptoms, diagnosis, treatment, prognosis, and prevention of lead toxicosis in cats. So what is lead? Lead is a heavy metal which is naturally occurring in the Earth's core. It also offers uses in other forms, like for humans in products. Currently, there are not as many uses of lead as there used to be back then, because we now know the risks associated with exposure to lead. So, currently, lead is being used in lead-acid batteries, and more specifically car batteries like the one shown here below. And due to the density of lead, it offers a shield of protection against radiation, so it's also used in X-ray bibs like the one shown here, as well as ammunition and weights, again, because of its density. Some past uses of lead include lead-based paint, which so happens to be the most common source to cause toxicosis. Some people don't even know that it's in their paint. There are ways that you can test it. I would recommend doing so if you have animals or children, and even yourself living in a home. Lead has also been used in the past as an additive to gasoline, as well as in pipes, which could be a source of contamination for lead-containing water. While lead can be found in man-made products, it can also be found in natural sources like water and soil. This is usually likely due to contamination from other lead sources. So, if a house has siding with lead-based paint on the outside and those paint chips fall onto the grass, the soil can absorb that lead and the accumulation can cause contamination of the soil and even water if there's water around as well. Water and soil can also absorb lead from sources like lead-containing dust, which can be produced by work sites, as well as leaded gasoline, and even the improper disposal of lead-containing batteries. Water has additional potential to be contaminated from lead, from sources like pipes and even lead-containing fixtures associated with water sources, such as your kitchen faucet or bathroom faucet or even your shower head, and even as well as corrosion from old pipes. So overall, if lead gets into contact with either water or soil, the likelihood of it being absorbed and causing contamination is extreme. While dogs have been proven to be at a higher risk of developing lead toxicosis, cats do also have some factors that cause an increased risk in them as well, such as their constant grooming makes it more likely that they will ingest lead particles during their grooming process, either from lead-containing paint that chipped away and that's within their fur, or even just from the lead-containing dust as well. That can be ingested and the accumulation over time can cause toxicosis. Along with grooming, hunting, killing, and or eating of prey can also be an increased risk of lead toxicosis. Other animals, especially ones in the wild, are not monitored for lead exposure, which means that your cat could potentially be ingesting a lead-contaminated animal. So if you just eliminate that altogether, you will not have a problem there. And then finally, if they play with any lead-containing objects that are around your house or apartment, that also poses an increased risk of ingestion and then therefore lead toxicosis. Particularly, kittens pose a greater risk because of their curious and playful nature, so I would just make sure to monitor whatever objects your cat or kitten is playing with. Alright, now on to the signs and symptoms associated with a cat experiencing lead toxicosis. Now, the most clinical sign that a veterinarian will see and associate with this health condition is going to be anorexia. This image to the right shows an extremely underweight cat. Anorexia can lead to a cat being underweight. This obviously is an extreme image of this, but it does represent what a cat should not look like. We can see here that its rib cage in comparison to the rest of its body is quite large, where it should normally be about the same size, just a little bit wider than the rest of its body and lower torso. And then if you take a look even at its front limbs, you can see that these are just extremely small for the size cat that it is, because this is an adult cat and these limbs need to be much thicker if you want to consider this cat healthy. Now, on to some other signs and symptoms, which include vomiting, seizures, lethargy, and weight loss. Now, seizures is typically associated with a higher and more extreme exposure of lead, which induced the lead toxicity. It is linked to central nervous system issues, which is one of the most affected symptoms of lead toxicosis in cats. The lethargy and weight loss, those can be associated with anorexia, but you don't need to have the anorexia in order to have the lethargy and weight loss. Oftentimes, cats will just have a decreased energy level as well as a decreased appetite for food, which can cause a slight decrease in weight, as compared to anorexia, which can cause a much more noticeable change in weight in a much shorter period of time. Once a veterinarian has identified all of the signs and symptoms of a sick cat in their clinic, and they have reason to believe that those symptoms are caused by lead toxicosis, their next step is going to be the diagnostic phase. They will first start with a blood lead concentrations test, which is the best and most accurate to test for lead toxicosis in cats. If the blood lead concentration of a cat is higher than 30 to 35 parts per million, then that cat is considered to have lead toxicosis. Now, if that amount is more like doubled, say 60 parts per million, that cat is considered to have extreme lead toxicosis. Whereas if you have a cat with only, say, 30 parts per million of blood lead concentration, then they are considered to have a more acute version of lead toxicosis, meaning that it will not have as severe symptoms and likely will not have any permanent damage after treatment. Another test that can be used in cats to diagnose lead toxicosis is the blood zinc protoporphyrin levels test. Now, this test is not good for acute toxicosis levels because it uses bone marrow concentrations, which is not often affected in minor cases and rather more commonly seen in the more severe cases. This ZPP levels test works when an animal has lead toxicosis and the enzyme substrate concentrations linked to the Heim synthetic pathway are disrupted. This enzyme, erythropoietic protoporphyrin, builds up in the red blood cells within the bone marrow, and it then binds to the zinc, which then forms ZPP. So, if an animal only has acute lead toxicosis, it will not be to the point where it has been absorbed into the bone marrow. which is why this is not a good test for any level of level of lead, but rather better used in the more extreme cases for further confirmation of the diagnosis. This image to the right shows a cat getting a blood pull from its jugular vein over here. This is how they would collect blood for either one of these tests. Alright, now on to the treatment after a cat has been diagnosed and confirmed to have lead toxicosis. The treatment is fairly simple and considerably minimally invasive for the cat itself. First, a veterinarian will start chelation therapy, which is the most direct form to correct lead toxicosis, and I will go a little bit more into depth about what that treatment entails in the next slide. Along with the chelation therapy, there is some supportive therapy that a veterinarian can offer as well, if they think that the cat needs it. This includes IV or subcutaneous fluids, antiemetics, which are anti-nausea medications, and anticonvulsants. The anticonvulsants help lessen or reduce seizures. Now, like I said previously, seizures typically are only associated with the more severe cases, so the anticonvulsants usually aren't given to cats with acute lead toxicosis, but rather the ones with the more extreme versions. And then as far as the antiemetics go, that, like I said, is just an anti-nausea medication. We don't want the cat vomiting or feeling nauseous when it should be regaining its health and getting back to its full normal capacity. So we will go ahead and we will give them anti-nausea medications if we notice that they aren't eating as much or anything like that, just so they feel a little bit more content and are able to stomach food a little bit better, which will in turn help their recovery. And then as far as treatment goes for the owner, there isn't any like pills or anything like that that are typically given for an owner to administer at home to their cats, but there are a couple things that the owner should do to help their cat in this recovery process. The first thing that they should do is they should walk through their home and any room where their cat is allowed, or any place where their cat is allowed, and look for any potential sources of lead. If you find anything that you think even has the slightest chance of containing lead, it's some really old toy, or, maybe the paint has lead in it, you aren't too sure, I would definitely confirm that and then make changes as you need to, as you can, and try to eliminate those sources as best as possible. And then once you have eliminated the sources entirely, you're also going to want to decontaminate the cat itself as well. Now, this isn't typically a fun experience for kitties. They don't normally like to be bathed by anyone but themselves, but in this case, it is required to help their recovery. Like I said previously in this video, a cat's fur can contain lead-containing dust and even lead-based paint, that just little tiny particles that have, floated in the air over time, they've fallen off of the walls or anything like that, come in from outside. Any source of lead that could have been emitted into the air or anything has potential of falling onto your cat's fur and it being absorbed and lost in there, and then it will be in there for longer than you think. So you're going to want to give them a bath. You're going to want to completely eliminate any potential lead that they have on their fur. Now, along with the bath, they will likely be given a cathartic by a veterinarian, and the most common and preferred ones are going to be the magnesium sulfate and sodium sulfate cathartics, which a cathartic is very similar to human laxatives. It gets the gastrointestinal tract of the cat moving a little bit faster, meaning that the lead is going to be expelled a little bit faster, and that is all things that we want. So if we can get that lead out of the system sooner, then we will. And we can try and we can do that or help that process with a cathartic. Now, in a rare occasion where a veterinarian is fairly certain that a cat has ingested a larger quantity of lead all in one sitting, or the primary source of lead exposure is from a larger piece of material that they ingested, then a veterinarian may also give an emetic, which is a nausea-inducing medication. And that means that the cat will be able to vomit up whatever lead-containing material they consumed. And again, we do want that because we want the lead to be in their system as little as possible. Now, this image over here, this shows an image of a cat receiving subcutaneous fluids, which that's going to be the layer between their skin and that muscle right below. It's like a little pocket in between those two layers where fluid can accumulate and therefore be absorbed into the skin. As you can see here, you make a little pinch between your two fingers and the needle goes in, and you start their IV drip and you get as much in as you need to, and then you just pinch that skin and you remove the needle as to stop the bleeding and stop any fluid from leaking. This is often given to cats when they're dehydrated. It can also give them a little boost when they're under the weather, and it's most likely the reason, or the most likely reason why it's given during this treatment is, like I just said, associated with dehydration, so this will help counteract that. All right, now a little bit more in depth on what exactly chelation therapy is in regards to treatment of lead toxicosis in cats. Now, this chelation therapy, it utilizes the property of chelators, which are chemical compounds that bind to metal ions and form a water-soluble ring-like structure known as a chelate. The most common agent for cats in chelation therapy is going to be this calcium EDTA. I definitely can't pronounce that, the full name of it, so I am just going to use this abbreviation here. The CaEDTA binds with lead ions in the body to form water-soluble complexes that can be excreted in the bile and urine, which are both liver products. Now, the way that this works is the calcium that is bound to this agent, the CaEDTA, is going to be replaced by a lead metal ion, which will then be expelled from the body in either the bile or the urine, and it will leave behind that calcium. This form of chelation therapy, or this form of lead toxicosis treatment, is either administered by a veterinarian through intravenous or intramuscular injection. So, like I showed in that previous clip, they could put it in that pocket between the skin and the muscle, or if they need a more immediate reaction from the therapy, then they will most likely do it intramuscular, where it will be metabolized a lot sooner. All right, so after your cat has been diagnosed with lead toxicosis and has been treated for lead toxicosis, the likely prognosis of their recovery is actually very good for a health condition like this. Now, the prognosis is dependent on severity, meaning it's dependent on the quantity of lead that they were exposed and the extremeness of the toxicosis that they are experiencing, meaning what symptoms do they have, what systems of their body are affected, like the central nervous system, just the liver, things like that. If there are more things affected, they do have a worse prognosis, but again, it is not a bad prognosis by any means. So, cases that are treated early and aggressively, they do have a very high rate of survival and don't typically cause any lasting or permanent effects. These animals that are treated early and aggressively will often show signs of improvement within 24 to 48 hours of treatment. Now, as for the more severe cases, again, treatment should be given as soon as possible, and they will also show signs of improvement within 24 to 48 hours, usually closer to the 48-hour mark in severe cases, but nonetheless still within the same range. The only thing different about severe cases is the long-term effects. With a severe case of a cat diagnosed with lead toxicosis, there is a higher chance of them developing permanent damage such as blindness or even recurring seizures. Now, this is rare, but it can happen, and while these things can occur, they are very easily manageable, and the cat should live a somewhat normal, healthy life. Okay, so this video just went into a little bit of detail about the signs and symptoms of lead toxicosis, as well as the diagnosis and treatment options and the prognosis of cats diagnosed with this health condition. Now we're going to talk about some preventative measures that owners can take to potentially decrease the risk of their cat ever getting lead toxicosis. So the first and foremost thing is that owners should remove any source known to contain lead and ensure that any new objects brought into the house do not contain lead. If you're in a home with paint, or especially an older home with painted walls, there is a chance that the paint within the walls or on the walls contains lead. You should do some testing to confirm that, and if you find out that the walls are covered in lead-based paint, then you should do your best to remove and replace that paint. Now, I know that can sometimes be a little bit of an expensive process, so for anyone needing a more financially friendly option, they can choose to just secure the walls as to avoid any falling paint chips, and they can keep a clean environment as to prevent any sort of dust accumulation, which has potential to contain lead. All right, and as far as the cat itself, the owners are going to want to monitor their play. By that, I mean make note of anything that your cat finds of interest that is not actually a toy. So if that's, a water bottle cap or, one of your makeup brushes or anything like that they show interest to, if you think that those objects have potential to contain lead, you should remove those products as well and replace them with more cat-friendly enrichment, like cat toys, or you could give them some interactive treats. You could even give them some catnip as well. The last thing that you can do to help your cat prevent your cat from getting lead toxicosis is you can prevent your cat from ingesting any sort of prey animal. Like I mentioned previously in this video, prey animals are not monitored by an owner like a domesticated cat is. So their exposure of lead is unknown, which means that the cat could be eating a lead-contaminated animal without your knowledge. So if you just eliminate them from hunting and ingesting prey animals altogether, then again, you already just eliminated another potential source of lead.